What I'm most curious about is, you're a practicing dentist, you're doing a ton of these cases. I mean, obviously, you're a really busy guy. Like I am, just from talking to your team, it's like you've got a lot on your calendar, and you're also putting these interesting courses together. So do you like enjoy the teaching? Like, what is it that made you want to? Because you didn't strike me as somebody that like their goal is to just be a consultant. Like you're obviously you love doing what you do. Did a lot of people reach out to you and it's like, hey, it's just easier if I just put it into a program instead of people harassing me all day long? Like, what was the motivation behind creating, the Thrive Dentist and all these great programs?
No, thanks a lot. It's a very good question. It's actually a very insightful question. I've always liked teaching, and teaching in very odd ways. Like in dental school, I would help the first and second years. As a fourth year, I'd go into clinic after hours and help 3 or 4 students that were just having a hard time with prep design or whatever. And honestly, there's a selfish element to it because it makes me way better. When you know how to teach something, or you're going through that process, it really shows you the holes in your armor. And you're like, oh, actually, I'm not really entirely sure why we do that. And, I hadn't actually thought about this. Someone else's hands found a problem that wow, you just saved me from something. So there's a selfish element to it. And then I really do enjoy teaching because it makes me, I think, substantially better. And you have to hold up your like a certain level of integrity because people are looking up to you to have answers. So there's a challenge to it. But I also feel like the coursework, it kind of came about because people were asking questions. And I thought, I don't think education's done right. And that's maybe an arrogant, maybe it's an arrogant statement, but I know that I would go to CE courses, some of the top courses in the world, from the Jason Smithens to Newton Falls to Bob Margis's, you name it. The people who are really good at what they're doing, Carlos de Carvalho. And the emphasis was always clinical. Which is awesome. Like I love that. And they're so good at what they do. But what most people don't realize is a lot of these people who are on the lecture circuit, you can talk about John Coyce, you can talk about Frank Spear, you can talk about Carlos de Carvalho. They're so talented and they don't practice the same way that we do.
Yeah.
They're not seeing patients that way because they're on the lecture circuit, 40 weeks of the year. So there's a different amount of time invested. That doesn't detract from it. It just means if you're going to learn how to have a successful practice, you have to learn from people who also are in the trenches with you. And so for me, I've turned down a lot of lecture opportunities, and I consistently do because I don't care to be on the road a bunch. What I care to do is actually live the things that I'm teaching. Right. And to me, that's more important than being out and about every other weekend doing that kind of thing. So that's how the courses really started to evolve, as a desire to bring coursework from learning to earning. I don't want you to have a bunch of head knowledge. I want you to say, okay, maybe I have enough. Maybe I've learned enough. The question now is, how do I integrate it to get the results? How do I work with a company like RevUp and actually give them the things that they need versus finding every little shiny object and distraction and never focusing on like the main thing that helps your practice grow?
No, I so agree with that, because like all of the courses that I've looked at, like you're right, most of it is clinical, right? So like an implant program, right? So people will go and then every course will teach you a really great job with the theory, right? So you go in and they're like, I don't know, in a hotel conference room kind of thing, and you're learning the theory and you practice on a typodont, right? And they're like, okay, you're good. You got it, right? Good, go for it. It's like, what do you mean go for it? Like I need to practice. Like, I've never done this before. It's like, so some courses you can bring your patients, but who's going to trust you at that stage? Like your mother-in-law? Like who's going to come in like, hey, I've never done an implant before. Can I take you to the course? I can practice on you. It's like, no, right? So a lot of them will, they'll go and they'll fly out to like, Mexico, Dominican, practice a bunch of implants really quickly, but they're not even there to see the whole restorative side of it. It's just like you drill and you fly back home. And then next year you show up to the advanced program where you fix all the first year students' mistakes, right? And then even with all of that, it's like, guys, like, how is your staff being trained? How did they talk to patients? How are you presenting treatment? How are you finding people? Like all of these business elements, everybody kind of glosses over like, don't worry, you'll figure that stuff out. It's like, What are you talking about? That's more, that's just as important as you understanding the clinical side. Like great, you learn how to do the conventional, you learn how to do the guided surgeries, you placed a couple implants. Like, what about the business side of it? And you're right, like a lot of these courses don't teach it because primarily they're flying around the country doing, constant courses on just the clinical training. So what I liked with your program is that you had some that really stood out to me. So one of them was like, how to do virtual consultations. How does that work? Like, what do you talk about? How do you engage with them? Because it's not as simple as, download Zoom and pop on a call and just chat and see what happens. Like, this is not going to work that way, right? So you've got a process for like, how do you integrate this into the workflow? What part is it in? Like, what do you talk about? Because that's just one small step. Then eventually there has to be a face-to-face consultation, and you're not going to have them open their mouth on camera to see what's going on. Like, but you have to build enough trust and rapport that they like you, they trust you, they want to come and see you. And then, what do you talk about then to move the process forward? You've got a course about, how do you build a fee for service practice? Because here's the thing, like most offices, dentistry is a unique sort of industry. Like if you've got 1,000 dentists in the room and you say, guys, put your hands up if your practice treats patients like family. All 1,000 put their hands up, right? It's like, okay, great. Put your hands up if you feel your practice offers a level of dentistry that's beyond what the average dentist offers. All 1,000 put their hands up, right? And for me, it's I'm like, guys, are you on drugs? Like I went to your practice, okay? I walk in and the decor looks like it's from the 80s, right? It like looks like you don't care, right? So it's like you don't care about your aesthetics. What you're going to care about mine? Like, it's subconscious, right? The staff don't even look up to greet you. They're like, "Hi, can I help you with something?" It's like, okay. Like my wife was actually at the practice just 2 weeks ago. She went to a dentist. She was in a waiting room with like 4 other patients. Somebody called because they had to cancel an appointment because their babysitter fell through or something happened, or it was some sort of emergency. The receptionist tone was very like, rolling her eyes, like, okay, whatever, we canceled it. And then they spent 15 minutes, the 2 receptionists spent 15 minutes talking to each other, bitching about the patient, right? There's 4 other patients in that waiting room listening in, right? It's like, well, what kind of experience do you think you're going to have there? I've seen another case. It was really funny. There was a practice who was trying to do more implant cases. So we started doing the marketing. We started getting more consultations for them. And, a lot of them kind of fell through. So, I'm curious, like what's going on? Like people don't call a dentist, asking about, cosmetic procedures for fun. It's not like they woke up that day, it's like, my teeth are perfect, I'm happy with them. But out of curiosity, I'm just wondering, like, what an implant costs. Like that person wants to buy dentistry, right? And usually by the time they call an office, they've had something that's bothered them, something about their smile for years. It's not like yesterday they were happy, today for whatever reason they don't like how they look. They were probably 100%. Bothering them for a long time. So patient comes in, and I'm looking at their practice, like, well, where do you do these presentations, right? So they don't have a presentation room. They do it in the staff lunchroom. And I'm looking around and like, okay, it's like cluttered and, there's, this is not a professional environment. So they're trying to pitch like a $20,000 implant case. And there's another staff member like heating up a pizza pocket in the microwave in the background, right? So like, when you ask them, like, so what happened with that patient? It's like, no, they didn't book. I don't think they were very serious about it. Yeah, I'm sure that's what happened. It's like that person wants to fix their teeth. What they weren't sure about is whether they should go to you or to somebody else. And I think those emotional, aesthetic sort of elements, like dentists don't quite understand how important they are.